Did you know that the same exercise that can heal your heart might also harm it if you don't follow the right precautions? Exercise can be one of the best medicines for your heart, but only if it's done safely. For seniors with heart problems or high blood pressure, the wrong moves, skipped warm-ups, or even holding your breath at the wrong time can quietly put your health at risk. In this video, we'll cover the key precautions every senior with heart issues must follow to exercise safely. From warming up, to pacing yourself, to recognizing danger signs, you'll learn how to protect your heart while still getting all the benefits of daily movement. Disclaimer: this video is for educational purposes only. It is not medical advice. Always consult your healthcare provider before making changes to your routine. The importance of precautions for seniors with heart issues. Exercise is medicine, but the wrong dose can be dangerous. For seniors living with heart conditions or high blood pressure, exercise is often described as one of the most powerful tools to stay healthy. Doctors recommend it to strengthen the heart, lower cholesterol, improve circulation, and keep blood pressure under control. But here's the catch. While exercise is essential, it must be done with the right precautions. Without them, the same workout that helps one person can become risky for another. Why precautions matter. The heart is a muscle, and like any muscle, it responds to stress. Gentle, steady exercise builds strength, but sudden, uncontrolled stress, like lifting too heavy, skipping warm-ups, or pushing too hard, can overload the heart. For seniors with narrower arteries, stiffer blood vessels, or past heart procedures, that overload can trigger dangerous spikes in blood pressure, irregular rhythms, or even cardiac events. Think of it this way. If exercise is a prescription drug, precautions are the instructions on the bottle. Without following them, the medicine may backfire. Understanding the risks? Stiff arteries, aging and hypertension reduce flexibility, making vessels less able to handle sudden pressure changes. Weakened heart muscle. Conditions like heart failure limit how much the heart can safely pump under strain. Medication effects. Some heart and blood pressure medicines lower heart rate or cause dizziness, changing how the body responds to activity. These factors mean seniors can't approach exercise the same way younger or healthier people might. What precautions achieve? When followed simple safety steps, like pacing yourself, breathing correctly, and cooling down, do three critical things. Reduce blood pressure spikes during movement. Protect the heart from overwork by keeping intensity in a safe zone. Improve long-term consistency because safe exercise feels better and builds confidence. Exercise is not optional for seniors with heart issues. It's essential. But without precautions, it becomes a gamble. Following the right safety rules turns exercise into reliable medicine, strengthening the heart, protecting arteries, and extending quality of life. For seniors with heart conditions, exercise should never be about pushing harder. It's about moving smarter, with safety first. Always warm up and cool down. Skipping warm-up is like asking your heart to sprint without warning. Many people think warm-ups and cool-downs are optional, something you can cut out if you're short on time. But for seniors with heart problems or high blood pressure, they're non-negotiable. In fact, skipping these steps is one of the most common mistakes that can turn a safe workout into a risky one. Why warming up matters. When you start exercising, your heart suddenly needs to pump more blood. If you jump straight into activity, your blood pressure and heart rate can spike before your arteries and muscles are ready. For seniors with stiffer vessels, this sudden jolt puts extra strain on the heart and may cause dizziness, shortness of breath, or even chest discomfort. A proper warm-up gently prepares your cardiovascular system. It increases circulation, loosens stiff joints, and signals your heart to gradually step up its workload. This smooth transition keeps your blood pressure stable instead of shocking it upward. Why cooling down is just as important. On the flip side, ending a workout abruptly is just as dangerous. When you stop suddenly, blood can pool in your legs, reducing blood return to the heart. This sudden drop in circulation can cause lightheadedness or fainting. For someone with heart issues, it also means the heart struggles to recalibrate smoothly. Cooling down with gentle movements and stretches allows your blood pressure and heart rate to return to baseline gradually. It's like landing a plane slowly and safely instead of slamming it onto the runway. Safe warm-up ideas, 3 to 5 minutes. Gentle marching in place, shoulder rolls and arm circles, slow leg swings or side steps, deep breathing with light stretches. Safe cool-down ideas, 3 to 5 minutes. Slowing your pace to an easy walk, gentle stretching of calves, thighs, and shoulders, seated forward bends or simple chair stretches, relaxed breathing to calm the nervous system. Extra benefits beyond safety. Warm-ups and cool-downs don't just protect your heart, they also improve flexibility, reduce the risk of muscle soreness, and make exercise feel easier. Seniors who consistently use them report fewer aches, more confidence, and better consistency. Never treat warm-ups and cool-downs as optional. They are the bookends that make every workout safe for seniors with heart issues. Watch your intensity. Pushing too hard can backfire on your heart. Many seniors believe that the harder they push, the better the results. But here's the truth. When you have heart problems or high blood pressure, overexertion is dangerous. Exercise should strengthen your heart, not strain it. That's why carefully watching your intensity is one of the most important precautions you can take. Why intensity matters. Exercise raises your heart rate and blood pressure temporarily. That's normal. But if you push beyond your safe limit, those numbers can surge into risky territory. Seniors with stiff arteries or weakened heart muscle may not be able to handle that extra load. Instead of building strength, overexertion increases the risk of irregular rhythms, shortness of breath, chest pain, or dangerous spikes in blood pressure. Think of your heart as a car engine. A steady drive strengthens it, but slamming the accelerator to the floor over and over will wear it out faster. Simple tools to measure intensity. You don't need fancy equipment to know if you're pushing too hard. Here are simple, doctor-approved methods. The talk test. If you can talk but not sing while exercising, you're in the safe zone. If you can't speak comfortably, you're pushing too hard. Perceived exertion scale, 1 to 10. Aim for a 4 to 6. You should feel like you're working, but not gasping or straining. Heart rate monitoring. Some doctors recommend keeping your heart rate in a specific range. For many seniors with heart conditions, this means light to moderate activity only. Always ask your doctor what's safe for you. Practical tips to stay in the safe zone. Start slow and build up gradually. Choose low-impact exercises like walking, cycling, swimming, or chair aerobics. Rest if you feel dizzy, unusually tired, or short of breath. Never compete with younger, healthier people. Listen to your own body. Extra benefits of the right intensity. When you exercise in the safe zone, you not only protect your arteries, you also build endurance, improve mood, and make workouts enjoyable. Seniors who stay in this moderate range are far more consistent, which means bigger long-term benefits. Exercise should challenge you, not exhaust you. For seniors with heart issues, staying in the safe intensity zone is the key to protecting your heart and reaping the full benefits of movement. Breathe the right way. One simple breathing mistake can spike your blood pressure. When it comes to safe exercise, most seniors think about movements, posture, or speed. But there's one factor often overlooked: how you breathe. Breathing may seem automatic, yet during exercise, many people fall into patterns that silently put their heart at risk. For seniors with heart conditions or high blood pressure, improper breathing can undo the benefits of the workout and even create dangerous spikes. The Valsalva maneuver, a hidden danger. Have you ever held your breath while lifting something heavy or straining during a movement? That's called the Valsalva maneuver. Holding your breath traps air in your chest, increases pressure inside your blood vessels, and causes your blood pressure to shoot up. For healthy younger adults, this might cause only a temporary rise. But for seniors with stiff arteries or weakened hearts, that surge can be risky, leading to dizziness, headaches, irregular rhythms, or even triggering chest pain. Why proper breathing matters. Breathing correctly keeps oxygen flowing to your muscles and brain, reduces strain on your heart, and helps keep blood pressure stable. It also prevents fatigue, because your body gets the fuel it needs to keep moving safely. In short, the way you breathe can be the difference between a safe, effective workout and one that puts you at risk. How to breathe safely during exercise. Exhale during effort. Push, lift, or strain while breathing out. Inhale during release. Lower, relax, or return to position while breathing in. Stay steady. Avoid shallow, rapid breathing. Keep it smooth and controlled. Coordinate with rhythm. Match your breathing to your movement. It should feel natural, not forced. Simple breathing exercises to practice. Before and after workouts, practice deep breathing to train your lungs and calm your nervous system. Diaphragmatic breathing. Place a hand on your belly. Inhale deeply so it rises. Exhale slowly. 4-4-4 pattern. Inhale for 4 counts. Hold gently for 4. Exhale for 4-4. These techniques not only support safer workouts but also reduce stress, which directly lowers blood pressure. Extra benefits. Learning proper breathing improves stamina, keeps muscles from tiring too quickly, and promotes relaxation. Many seniors also report better sleep and reduced anxiety when they incorporate mindful breathing into exercise routines. Safe breathing is as important as safe movement. For seniors with heart issues, never hold your breath during exercise. Exhale on effort, inhale on release, and let oxygen protect your heart. Environment and timing precautions. Where and when you exercise could make the difference between safe and unsafe. For seniors with heart problems, exercise safety isn't just about the moves you choose. The environment and timing of your workouts play a huge role in protecting your blood pressure and heart. Ignoring these factors can quietly turn even the safest exercise into a risky one. Temperature risks. Heat. Exercising in hot, humid weather causes dehydration. When you lose fluids, your blood thickens and your heart has to work harder. Heat also dilates blood vessels, leading to unstable blood pressure. For someone with hypertension, this can cause dizziness, fainting, or dangerous spikes. Cold. On the flip side, cold weather makes your blood vessels constrict, forcing your heart to pump against extra resistance. This can push blood pressure upward in seconds. Cold air can also reduce oxygen uptake, leaving you short of breath. Timing around meals and medications. After meals, exercising immediately after a large meal diverts blood to your digestive system. This can leave less blood flow for your muscles and heart, making you feel dizzy or faint. It's best to wait 30 to 60 minutes after eating. On an empty stomach, exercising when you're too hungry can also be risky, causing low blood sugar, weakness, or fatigue. A light snack like fruit or yogurt helps keep energy steady. Medication timing. Blood pressure or heart medications may affect when you feel strong enough to exercise. Some cause fatigue right after taking them, while others lower heart rate. Always track how your body responds and adjust timing accordingly. Environment beyond weather. Air quality. Polluted air or heavy traffic areas strain the lungs and arteries. If possible, choose parks, indoor gyms, or home-based routines. Safety. Seniors with balance issues should avoid uneven sidewalks or poorly lit areas to reduce fall risk. Safe practices. Exercise indoors during extreme weather. Schedule workouts at the same time daily to build routine. Stay hydrated before, during, and after activity. Dress appropriately. Breathable clothes in summer, layers in winter. Use supportive shoes to reduce joint strain. Extra benefits of the right environment and timing. Choosing the right time and place doesn't just keep exercise safe, it makes it more enjoyable. Seniors who avoid harsh conditions and plan their workouts around meals or medications find it easier to stay consistent. And consistency, not intensity, is what truly lowers blood pressure over time. For seniors with heart issues, safe exercise isn't only about what you do, it's also about when and where you do it. Respect your environment and your timing, and you'll protect your heart while reaping all the benefits of movement. Warning signs you must never ignore. Your body sends signals when exercise is no longer safe. Never ignore them. Exercise should leave you feeling energized, not frightened. But for seniors with heart conditions, it's important to recognize that the body has warning signals. Signs that mean it's time to stop immediately. Ignoring them can turn a safe routine into a medical emergency. The most critical warning signs: chest pain or pressure. Any tightness, squeezing, heaviness, or pain in your chest during activity is a red flag. This can signal angina, reduced blood flow to the heart, or even the start of a heart attack. Stop right away and seek medical help. Unusual shortness of breath. Feeling slightly winded is normal, but gasping for air or struggling to breathe is not. Seniors with heart issues should never push through breathlessness, dizziness, or lightheadedness. If you feel like the room is spinning or you might faint, your blood pressure may have dropped or spiked suddenly. This could be dangerous if ignored. Rapid or irregular heartbeat. A racing, pounding, or skipping heartbeat can signal arrhythmia, an irregular rhythm that needs medical attention. Unusual fatigue. Tiredness that feels extreme or out of proportion to the activity may mean your heart isn't pumping effectively. Pain in arms, back, neck, or jaw. Heart pain doesn't always show up in the chest. Discomfort radiating to these areas can also signal heart trouble. Why these signs matter more in seniors. With age and conditions like hypertension, the heart and arteries have less flexibility. What feels like mild discomfort in a younger adult can escalate much faster in a senior. That's why doctors emphasize that seniors should never push through pain or ignore unusual symptoms. What to do if warning signs appear. Stop exercising immediately and sit down. Take slow, deep breaths. If symptoms don't improve quickly, call for medical help. Keep emergency contacts and medication like nitroglycerin if prescribed close during workouts. Never try to walk it off. Waiting too long can turn manageable symptoms into life-threatening events. Extra benefits of listening to your body. When seniors learn to respect these signals, they feel safer and more confident in their exercise routine. Knowing when to stop doesn't mean you're weak. It means you're smart. Safe habits help you stay consistent, and consistency is what truly strengthens the heart. Pain, dizziness, breathlessness, or irregular heartbeat are not just part of exercise. They are red flags. For seniors with heart issues, listening to your body can save your life. Doctor-approved safe exercise routine. Tie everything together. Here's how to put all the precautions into one safe plan. By now you've seen why seniors with heart issues must take exercise seriously. The right precautions can mean the difference between protecting your arteries and putting them under dangerous stress, but theory alone isn't enough. Let's turn this into a practical, doctor-approved routine you can follow with confidence. The three-part formula. Every safe workout for seniors should include warm-up, 3 to 5 minutes. Prepares the heart and arteries gradually. Main exercise, 10 to 20 minutes. Gentle, steady, low-impact movement. Cool down, 3 to 5 minutes. Smoothly lowers heart rate and blood pressure. This formula is simple, flexible, and effective, no matter what time of day you exercise. Sample 20-minute routine. Warm up, minutes 1 to 4. March slowly in place. Shoulder rolls and gentle arm swings. Deep breathing to oxygenate your body. Main exercise, minutes 5 to 16. Choose one activity, brisk walking at a pace where you can talk but not sing. Stationary cycling with light resistance, water aerobics, or swimming for joint-friendly cardio. Chair aerobics for those with balance issues. Strength and flexibility, minutes 17 to 18. Light resistance band pulls. Seated leg extensions or wall push-ups. Cool down, minutes 19 to 20. Slow walk or gentle marching in place. Simple stretches, calves, thighs, and shoulders. Deep breathing to relax arteries and calm the nervous system. Safety checks during the routine. Use the talk test to monitor intensity. Never hold your breath. Exhale during effort. Inhale during release. Keep water nearby and sip as needed. If you feel dizzy, stop immediately. Extra benefits of a structured routine. This type of plan doesn't just lower blood pressure. It also improves balance, reducing fall risk, strengthens bones and muscles for independence, enhances circulation, supporting brain and lung health, reduces stress, which further lowers blood pressure. A safe routine isn't about doing more, faster. It's about structure, safety, and consistency. Follow this three-part plan daily, and you'll give your heart the protection and strength it truly needs. Conclusion. Exercise is one of the most powerful tools to protect your heart, but only if it's done with care. For seniors with heart problems or high blood pressure, the right precautions turn every workout into safe, natural medicine. Warming up, pacing your intensity, breathing correctly, choosing the right environment, and paying attention to your body's warning signs are not just extras, they're lifesavers. Here's the good news. When you exercise safely and consistently, you don't just lower your blood pressure. You improve your energy, balance, sleep, and independence. That means more freedom to enjoy life without fear that your workouts are putting you at risk. Disclaimer: this video is for educational purposes only and does not replace professional medical advice. Always consult your doctor before starting or changing your exercise routine. If you found this video helpful, give it a thumbs up, share it with someone who needs it, and don't forget to subscribe for more doctor-approved tips to protect your heart and live healthier every day. Thank you for watching.